Still okay. I I'm going to be taking you on oral pathology and microbiology. First and first, I decided that we will have to shorten everything. So I'd like for you to do away with the links that I sent to you in the past because I kind of studied it and I realized that it's going to give you a whole lot of stress. And it's also going to give me stress trying to set lots of questions, and you on the other hand might have some difficulties trying to go through these materials, at least when you're trying to guess what I will be setting for your exams question. So first and first, we're going to be starting all over again. My screen is shared, as you can see, oral pathology and microbiology. And according to your scheme of work, we're going to be talking about nature and principles of pathology. Okay, nature and principles of pathology. Course rep, I'm going to be dropping these notes one after the other. If you have any questions, you can send in to the chat of the link of this video, and I will either make a video to correct it or to answer it, or I will answer it directly either on your WhatsApp or on the chat. So once again, my name is Judith Ifoma Basilo Keke. I guess you all know that already. So let's dive in. We have nature and principle of pathology. First and first, we're going to begin with Unit 1 of oral pathology, a fundamental part of your second year dental technology training. So don't worry of the terms, sound complex. We're going to break everything down in a way that's simple and practical. Our goal is just to memorize, but to understand. Sorry, our goal is not just to memorize, but to understand what diseases are, how they affect the body, and most importantly, how they show up in the mouth. You know, we've done some parts, but I will go over it. When we say what is pathology, let's start from the word pathology. Pathology. Um, we said it before. It means the study of disease, but the word comes from two parts: pathos meaning suffering, and logos meaning study. So pathologist literally means the study of suffering. But what we study in pathology, what we study in pathology is disease. So there are four things, main things that we look at in pathology. As you can see in your material, there are four things that we are looking at in pathology. And I'm going to be calling it out, which is what, just like you're saying it in your material, it's the cause of disease, which is etiology. Etiology. And the second one is how the diseases develop, which is pathogenesis. And what causes it, what changes happen in the body, especially tissues, which is the morphology of the body, what happens, and what those changes leads to, that's the effects on function, which is the clinical effects. So the four things that we're looking at in pathology is the cause of the disease, how the disease develops, what it does to the body, that's the changes in the body, and what these changes leads to, the effect, the functions of these diseases in our body when we have them. Okay. And now, for example, imagine someone has gum disease. We will study what caused it, how it progressed, what physical changes are visible, and what symptoms the patient feels. I'll go over it again. We're talking about pathology, and we're saying if, for example, someone has a gum disease, because you are in dental tech, so I this is the first time we're bringing dentistry, dental technology fully into microbiology. So initially, this course had to do with telling you about microbiology and what you need to know. So I try as much as possible to make you relate well with microbiology and oral pathology. So imagine if someone has a gum disease, what caused it? What we're going to looking at in pathology is, oh, what really caused it? What caused this disease? Maybe poor oral hygiene, bacteria, how it progressed, how is it going so far? Um, Maybe there's an inflammation. You remember we talked about inflammation in our last class? Oh, there's a tissue damage in the mouth. Okay. Remember we're talking about etiology, pathogenesis, morphology, and effect. And the morphology, what physical changes are visible? Are there swollen gums? Oh no, my people, Nigeria has finally happened to your teacher. Hmm. I'm going to continue because we are all Africans. We understand what happens. Currently, I don't have a touch, but I'm going to get a LED light. So in my next class, it's not going to be like this. Let me issue a command so they turn on the gen. Hold on. Oh, I didn't I didn't turn off the mic. Okay. So like I was saying before I lost power. So what physical changes are visible? Is it swollen gum? That's the morphology now. And the last one, which is the effect, is and what symptoms the patients feel. Does this patient feel bleeding, pain? Do you get it? I think you're understanding it clearer this time around. So let's talk about infection. 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 This simply means the invasion and multiplication of harmful microorganisms in the body. Infection. Let's list a few. We have one, which is bacteria. Bacteria. Example of a bacteria is Streptococcus mutans. I'm sorry, guys. The power will soon be restored. Um, I've asked them to restore power. Okay, power will soon be restored. I've asked them to turn on the generating set. So as soon as they do, you're going to see my face clearly. But for now, I think we need to manage what we have going on. Okay. So we're talking about infection. Mm, so so we say bacteria. One of the examples of bacteria is Streptococcus mutans. Streptococcus mutant is a bacteria. And we have the second one, viruses, which is herpes simplex virus. We have the fungi, which is Candida albicans. Candida albicans. So the fourth one, which is the protozoa. Yeah, guys, I guess you can see me now. Jen is not the AC is not on. Oh, it's good to have you all back. I'm back. So, like I was saying, so protozoa, we have the entamoeba gingivalis. Entamo. Okay, entamoeba gingivalis. Entamoeba gingivalis. Okay, so you're going to, these invaders can cause inflammation, pus, pain, or even ulcers in the mouth. So um take notes, like I said, you don't really need to kill yourself over the spelling, but we're going to try to get it. But make sure that when you are spelling, you're spelling correctly. Okay. For number three, which is the mode of transmission. Mode of transmission. We have the direct transmission and the indirect transmission. So let's talk about how infections spread. Imagine someone sneezes next to you. Germs can spread in two ways: direct transmission. We have the touching someone, shaking hands, saliva droplets, that's the coughing, the sneezing. We have blood, which is the cuts, the injuries, unprotected contacts like sex and all of that. So we have the indirect transmission, which has to do with contaminated surfaces, like mine. It's actually dirty. Shared objects, contaminated surfaces, door handles, shared objects like utensils, tools, working tools, spoons, water, cups, sorry. So contaminated food or water. These are indirect transmission. So if you touch a doorknob that someone with a flu just used and then touch your mouth, that's indirect transmission. You didn't get it from the person, but you got it from an object. So someone who has flu opened the door after sneezing, didn't wash their hands, and you go and touch the knob. That was when during the era of coronavirus, we were asked to wash always. So you go and touch the knob, and as soon as you touch the knob, what happens? You you sorry, and you go straight without even washing your hands, and you go straight to take something and put into your mouth. That's an indirect transmission. You practically have this infection. That's how you can get it, actually, not like. So now we're going to be looking at um basic cell and tissues. So let's review some biology basics. Every disease starts with something changing at the cell or tissue level. Every disease starts with something changing at the cell or tissue level. Firstly, we have the cell structure and function. We have the nucleus. Think of it as the brain of the cell. Think of it as the brain of the cell. The nucleus, nucleus. Um, it controls everything. Second one is the cytoplasm. This is the jelly-like stuff inside the cell where all the work happens. We have the plasma membrane. It is like a security gate. Remember, I said the nucleus? The nucleus is like the brain of the cell, it controls everything. We have the cytoplasm. This is the gel-like stuff inside the cell. You know what a gel-like is? So this is where all the work happens. So we have the plasma membrane. It is a security gate deciding what enters and exits the cell. That's the person that mans that the plasma membrane mans the body, the cell. It's like the security gate. It decides what enters or exits the cell. So types of tissue. Every organ is made of these. Every organ, every organ is made of these. Note that every organ is made of these. So let me go forward and be fast about it. So we have the types of tissue. Every organ is made of this, like I said. We have the epithelial tissue. This covers surfaces like your skin and the inside of your mouth. We have the connective tissue. This supports and holds tissue together like bones and ligaments. We have the muscle tissue. This helps in movement. We have the nervous tissue. This sends signals like a phone line from brain to the body. The nervous, where your nerves, they send signals. The nerves are the ones that send signals when someone pricks you, when there's a sharp pain on your body, on your skin, the nerve sends signals. Your muscle helps in movement. You have the muscle on your body, that's why you're able to move your hands, do things. So no, remember that the nervous tissue is like a phone, like the brain to the body. Okay, so I do not have so much time to add the picture holders. From our next class, I'll try as much as possible to show you diagrams. This will help you, but because I left some picture placeholders for you, so you can go and use this. Go to your Google and search these images. So in order to summarize lesson 1, which is unit 1, we're going to say that I started with telling you that pathology is a study of disease. That's the cause to effect. We talked about infection, which is microbes entering and growing on the body. And we talked about infection spread through direct and indirect means. Cell have parts, tissues have types. All of these can be affected by disease. So on the comment section, if there's someone that can give me an example of a direct transmission from daily life and what tissue type lines in your mouth, that would be a great, a great, that would be a great one for us. So you can leave it on the comment section of this video. Um, So now that we know what diseases is, next we're going to look at how the body responds to it. That's the response is called inflammation. So our next topic for this curriculum, oral oral pathology and microbiology, is inflammation and tissue repair. Inflammation and tissue repair, as you can see here. Okay, guys, thank you so much for watching this video. Bye.